The knee is composed by the cartilage, the meniscus, and multiple ligaments that keep the shin bone and the thigh bone together. In the inside of the knee, there's two ligaments that are the most important, the ACL and the PCL. The ACL is the anterior cruciate ligament, which is very important for the stability of the knee. The ACL controls the translation of the shin bone forward, but also the rotational aspect of the knee. When you have an ACL tear, people will have a lot of translation, more than normal, on the shin bone in respects to the femur or the thigh bone, but most importantly, they will have rotational instability. So people will notice when they're doing pivoting activities that their knee gives way. They feel that their knee goes one way and your body goes the other way. In those cases in which people cannot cope with ACL tears, it's important to repair this. What we actually do in most cases is not repair the previous tissue because we feel that it's elongated and the re-tear rate is actually quite high. What we do is something called a reconstruction. In those cases, we take a tendon from somewhere else to be able to replace that ACL. The tendon can come from the patellar tendon, which is the tendon from the kneecap that goes to the shin bone, or it can come from the quadriceps tendon, which is the tendon on top of the kneecap. Alternatively, we can get the tendons from the hamstrings, which are tendons that come to the inside of the shin bone. All those tendons can be viable options, and depending on the type of sport, what people want to get back to, we may choose one over the other. It's our preference to use a bone-tendon-bone graft because it has been shown in over 30 years to be the strongest graft with the least re-tear rate, the least infection rate. A bone patellar tendon bone allograft or autograft can be taken from the center of the patellar tendon. We take 10 to 11 millimeters. The tendon is usually 35 to 40, so you take only 20 or 25% of the tendon. You prepare that on the back table with sutures to be able to pass that, and then we drill sockets into the shin bone and the thigh bone to be able to reconstruct the ACL. With time, what the knee does is the so-called ligamentization process, where that tendon becomes their patient's own ligament and functions just like a normal ACL.